Hi, this video is the art of hair transplant restoration surgery on a client who has a balding from front all the way toward the back. He's class 4 or 5 hair loss pattern. Patient opt for the FUE method, so we're gonna attempt to do around 2,500. 2,500 will cover the front half of the head. If you look how I draw. So from here to here is around 2,500 or maximum 3,000 grafts. On average, the band here is around 2,000 grafts. So most people will opt to do the 2,500, at least to get the front half done. And with the front half done, even though the back, you can always wait a year later to do it, or you can take medicine like Propecia and Rogaine, works pretty well in the back, but in the front it doesn't do much for it. Hair transplant, as you know, is an art form. It requires a lot of the artistic and aesthetic detail to ensure a very natural result. From the mid eyebrow to the hairline, on average for Asian and black, around 6.5 to 7 centimeter, and for Caucasian, it's around 7.5 to 8.5 centimeter. And then the more narrow the face, the more arched back the hairline will be. The more round the face, the more flat the hairline is. And so this patient is somewhere in the middle. And then no hairline straight, because the line is an imaginary line. Can we dance up down the line zigzagly? The more zigzag you have, the more natural it is. Now, but we have two type of hairline. We call the soft hairline and the tight hairline. And so the soft hairline, it has a bigger zigzag and a lot more root to grow single hair graft. Or the tighter hairline is a smaller zigzag, and it gives you a sharper look, and but it's still gonna look natural. It's not a straight line. And then once we get the hairline shape down, we will transplant at 35-45 in the front, increases when you go backward and change when you go a different direction. Selection, not only the precise angle is important, selection of hair grafts is important. We transplant rows and rows of single hair graft in the front, followed by 2 hair, 3 hair, and 4 hair in the back for bulk and volume. As you know, I'm one of the very few hair transplant surgeons who specialize in the art of hairline restoration and who also specialize in FUE. There are 3 type of group of clinic doctor does FUE. There's one type which produce the best result is where the surgeon specialized in FUE and the surgeon personally pulling the hair one root at a time. Only the surgeon has the depth of knowledge and the skill to pull in hair one root at a time. Not all surgeons can do FUE. When we first graduate from school, we all know how to do strip method, FUT, but only through the years you become a specialist and has more skill, then you become an FUE specialist. And again, when you interview a doctor or a clinic, you want to know if the surgeon or the doctor actually pulling the hair one at a time himself, and that tends to produce the best result. So then there's another group that use neograph or robotics, and that's the group that can do, some of them they can do the strip method, but they cannot do the FUE personally, so then they buy the machine to pull it out for them. And then those are called robotic artists, and the transaction rate won't be as high. And transaction rate is higher than the surgeon who specialize. So you know they won't produce as good density as with my work. Why? Because you know if the surgeon can do it themselves, you know why would they get the robot? And again, if the robot is better than me, I wouldn't waste my time sitting there pulling one at a time. I might as well buy 10 machines and pull it out more financially better that way instead of me inefficiently doing it. Why I'm inefficiently doing it? Because I take my time and I want the best result. That's why the robot doesn't produce the same, and the density is not even close. The third one is neograph. The neograph is the technician operating on you, so the doctor doesn't operate at all. They will say hi, collect your money and say bye, but the technician doing the whole amount. Of course they're cheaper, but the downside is technician who are not even doctor, imagine they design your hairline, they can ruin your life. Number 2, technician is pulling your hair one at a time. Of course the quality is not even close. So you want the best result with the best aesthetic result and the best density, you want to go to the surgeon who's personally pulling the hair graft one at a time. Thank you.